Hi, this is Dr. Kelly Mulhern from Thrive Wellness Center, and today we're going to be talking about allergy and sinus headaches. Now, if you've been following some of my previous webinars, we've already done one on a kind of broad overview of headaches in general. We've done another webinar on stress type of headaches, stress and tension headaches. So allergy and sinus headaches is the next one. These webinars are designed to be able to watch all in a row or to do kind of one here and there in whatever order you choose. A little bit more about Thrive Wellness Center. We offer a variety of services, kind of a one-stop shop to help people reach the level of health and wellness and fitness that their body desires. And I always like to take a quick minute to thank you for taking time out of your hectic schedule. I know our lives are so busy and we're pulled in a million different directions, so I appreciate you taking some time to be with me today and to put your health as a priority. Before we begin, I like to mention that as this is a webinar, if you have specific questions, please feel free to email me. I will have the my email address on the last page once we get through the webinar. I try to keep these webinars under 20 minutes. Sometimes they go over, so if it goes over, please bear with me. But that's where we're going to start. A little bit more about myself. I jokingly say that I have alphabet soup after my name. I'm a lifelong learner, and so a few things about me. I am a member of the Foundation for Wellness Professionals, which is a 501c3 nonprofit organization. We are dedicated and committed to helping communities learn more about health and wellness and what their options are. So I'm a volunteer for them, and I go out into my local community and do no-cost workshops and health talks for businesses, organizations, etc. So if you are in the Tampa Bay area and would like me to come and do either a virtual class or one in person, again, there is absolutely zero cost for that. I do that as part of my volunteer work for the Foundation for Wellness Professionals. Now, by training, I am a doctor of chiropractic, and I've been in practice over 15 years. In addition, I have a master's degree in public health with a concentration in epidemiology. So what that means is I spent almost another 2 years postgraduate learning about microbes, viruses, bacteria, transmission routes, epidemics, pandemics, all that cool stuff. So I have that master's degree as well. I'm currently enrolled in a postdoctoral certification in functional medicine, and I've completed a postdoctoral certification in the diagnosis and treatment of accident-related trauma injuries to the head and neck. I'm also a published author, and I like to say that I'm on a mission. And my mission, as simply put as I can make it, is in my lifetime to help as many people as possible live happier, healthier, and longer lives without the need for drugs or surgery. So it's a big mission, and to help with that, because in my office I can only see one person at a time, but that is why I work with the Foundation for Wellness Professionals. It is why I do webinars. It is why I do health talks in my community to help people obtain some of the knowledge that I've gleaned over the years. Now, if you've listened to the other webinars, we are going to be talking about different types of headaches. So just as a quick review, we've already talked about stress headaches. We are today talking about allergy and sinus type of headaches. Cluster headaches will be on the agenda for a later webinar, as well as migraines due to headaches due to high blood pressure, hormonal headaches, and even migraine headaches. So that gives us kind of a roadmap of what we have talked about, what we will talk about. Now, all of these webinars, I will always mention one last type of headache, which is a pathological headache. A pathological headache is an emergent headache. It is one that patients will describe as being the worst headache of their life. If they've had headaches in the past, this may be one that is completely out of their normal in terms of the symptoms that they're having. Maybe it wakes them up in the middle of the night. Maybe they're losing their vision, or they have facial numbness. Now, sometimes that can simply be a migraine, but other times it can be pathological. And by pathological, we mean it's caused by something that is big, bad, and ugly, like an aneurysm or a clot, so a stroke, or a tumor. And so when talking about headaches, if you're having significant headaches, you owe it to yourself to make sure you work with a qualified healthcare professional to help figure out what kind it is, to get proper testing done if needed, to make sure you don't have one of the big bad uglies lurking in the background. Now, headaches, when we're talking about treatment, the treatment is completely determined by the cause of your headache. And that sounds kind of simplistic, but it is so important. I have yet to meet a single patient in over 15 years of practice whose headaches were caused by a deficiency of aspirin, Tylenol, naproxen, Aleve, Excedrin, etc. And we take those things because we've got busy, crazy, hectic lives and we've just got to get through our day. But we just need to realize that that's putting a Band-Aid on the problem. And I like to try and figure out what is the root cause of this problem and how do we correct it so that the person is no longer suffering, or if they're still having headaches, they're much less frequent, much less intense. And I always also mention that you can have more than one headache at the same time. It's like adding insult to injury. It's when you have a sinus headache and then you get a migraine on top of it, or you have a stress headache and a high blood pressure headache at the same time. And this is again where it's super important to work with a qualified healthcare professional that is versed in headaches, that can help you figure out what is causing your headaches, and then map out an effective treatment strategy so that you're not suffering. But again, that proper diagnosis is paramount. Now, jumping right into allergy and sinus headaches, the location of the pain, that can be one way that we can discriminate between different types of headaches. So this graphic shows you 3 of the most common sinus locations. Now, a sinus is essentially an air-filled cavity in the bone. And the reason why we have sinuses in our skull is because if the skull was solid bone, it would be way too heavy for us to hold our heads up all day long. So we have several sinuses or air pockets in our skull. Up at the very top, we have the frontal sinuses. Those are above the eyebrow, kind of below the eyebrow, but up against the nose itself. Those are the ethmoid sinuses. We have the maxillary sinuses, which are passed out to either side from the flares of the nose, underneath the eyes. And if you've ever had a sinus headache, you kind of intuitively know these locations because that's where it hurts. And that's where you might put pressure to try and help relieve the pain. So you might be looking at this picture saying, oh yeah, I totally get that. Now, again, frontal, the ethmoidal sinuses are sometimes called the nasal sinuses, and then of course the maxillary regions. We also have our sphenoid sinuses, we have our mastoid air cells, so we do have other locations, but these are the 3 most common. Now, what causes a sinus or an allergy headache? Well, to start with, it could be allergies. Now, allergies, we can think of these in a couple different ways. First, you can have actual allergies to environmental triggers, things like mold, pollen, dust, dander, trees, grass. Second, you can have allergies to foods that can cause headaches. You can also have allergies to medications. Now, sometimes it's a true allergy, which can be determined by testing. Other times it's more of a sensitivity, meaning you don't actually have an allergy, but the more that you're exposed to either the environmental, the food, or the medication trigger, the more likely these things are to manifest. But oftentimes we'll see this in combination with a hay fever kind of allergy. Also with mold, we can see this a lot in the Tampa Bay region and Southwest Florida. So there's a lot of mold in Florida, and mold loves the sinuses. They are warm and dark and moist, and so mold will thrive in there and build a biofilm over themselves so that treatment can be extremely difficult, but that can be one additional cause of ongoing sinus type headaches. Colds and flus, if you have some kind of a viral or bacterial infection that's wreaking havoc on your body, whether it's in your lungs, in your throat, it's all connected, so it can kind of, I don't want to say like bleed over into, but leak into the sinuses and cause pain and pressure there as well, just as the mucus fills up. Low pressure weather patterns are also a frequent trigger. So by low pressure, when the barometric pressure drops, that's when we're going to see things like rain and thunderstorms, hurricanes. So as that pressure drops, then that can trigger that sinus pressure and headache. Cold temperatures can as well as low humidity or dry air. So if you live in the northern states, you may find that you may be more predisposed to having the sinus type of headache in the winter when things are really dried out, or in the spring as everything starts to bloom and goes hand in hand. Now, what are some signs and symptoms of an allergy or sinus headache? Well, the first is going to be facial pain. Now, we already talked about the sinus locations, so of course you can have pain over the sinuses, but really the pain can be almost anywhere in your face, even at kind of below your ears. It can even cause sometimes ear pain. You can have swelling of your sinuses, so your face might look a little puffy in those areas. You can have obviously congestion. Oral or jaw pain can happen as a result of these sinus headaches, and sometimes it's because we're gritting our teeth because the headache hurts, and other times it's just the nerves in that facial region are all just hypersensitive because they're all being irritated. Obviously a runny nose, red and itchy eyes, postnasal drip. So we can think of anything that we commonly associate with allergies as going along for the ride with these allergy and sinus type headaches. So what do we do about them? Well, very simply, we have to address the underlying cause. So if you're allergic to Fluffy the cat, I'm not going to say you have to get rid of Fluffy the cat. That's going to be your call. But maybe Fluffy the cat needs to be bathed more. Maybe Fluffy the cat needs to have a special shampoo to decrease dander. Maybe you need to install an air purifier in your home to try and get rid of Fluffy's dander. So getting to that underlying cause. So that's allergies, and of course with allergies we can avoid it. So let's say you don't own Fluffy, but maybe your best friend does. Well, then stop going to the best friend's house and meet somewhere else when you decide to spend time together. Desensitization is a process by which you are exposed to small amounts of the allergen that increase over time, and the hope is that we're going to get your body to chill out and not be so hyperactive when it is introduced. An allergen is typically something that is innocent, that your body is just, your immune system's over responding to. So if we can modulate the immune system to help it calm down, if we can just expose it to slow amounts over time, that's the whole theory behind allergy shots. Some people find relief with that, others not so much. Of course, antihistamines can help with symptomatic relief. Decongestants again help with symptomatic relief. Humidity, if it's a matter of dry, cold air, then let's get a humidifier going, or let's warm up the temperature. Unfortunately, if it's the weather, there's, well, not so much you can do about the weather patterns. So unless you decide you want to completely move, which some people do, to get away from an allergen or weather patterns. And then sinus hygiene. So following proper sinus hygiene can help reduce or mitigate the frequency, severity, duration of these sinus type headaches. What the heck is sinus hygiene, you ask? I'm so glad you asked. So sinus hygiene involves taking care of those sinuses, and it can be something as simple as a saline flush. So you can see that picture in the middle. You can find these in your grocery store now. Different brands make saline of in a bottle or some sort of container that you can spray up your nose to flush it out, and that can help. Basically, allergens, oftentimes when you're breathing, they get trapped first in your nose. So it's kind of like, let's flush it out before it takes root, or before your immune system really notices it's there and responds. We also recommend this when people are just starting cold and flu season to do these flushes, because so many respiratory issues, the virus or bacteria will proliferate in the throat, in the sinuses, in the nose. So cleaning those areas and flushing them to mechanically get the allergen or virus or bacteria out of the body can be really useful. Personally, I personally I feel like I'm drowning when I do those, but some people absolutely swear by them, so it is an option. Now the neti pot, that's down in the lower left-hand corner. The neti pot has been used for centuries in different cultures, and basically it's a similar thing where you're flushing the sinuses out. The caution with this is do not use tap water. It seems like every few years there's somebody who uses tap water with one of these, and they can, if there are bacteria or other pathogens in the tap water, it can cause sickness and problems. So do not use tap water with a neti pot. You want to use distilled water, saline, sterilized water, something along those lines, to make sure you don't hurt yourself. Get a humidifier. Again, if in Florida, I find myself maybe 2 weeks out of the year telling patients, well, you can get a humidifier, but probably they never do, because most of the time down here it's humid and it's not needed. But for northern climates, a humidifier might be needed 4, 5, 6 months out of the year. Now, if you don't want a humidifier, then another simple way to do it is you can run your shower really hot and let the steam kind of billow out. You can put a pot of water on your stove and boil that and let the steam come up from there. And that's always nice because you can throw in cinnamon or cloves or orange peel or something to kind of make the air smell nice while you do it. Or for a more localized, you can always do a bowl of steaming water and do a kind of a tent over your head with a towel, so that you're just getting the steam directly into your sinuses. But again, you want to use caution with that the water's not too hot. And then essential oils, there's many essential oils that can be used for sinus health. But probably one of my favorites is tea tree oil. Tea tree oil I would add to the steam tent if I was doing a steam tent, or if I was using a humidifier, I would add it to that. I would not add it to the neti pot, and I would not add it to the saline flush. So again, do not put the essential oil in the neti pot or a saline flush. But tea tree oil is a natural antimicrobial, antiviral, antibacterial. It's great for skin issues. So that I would do in the tent, depending on what else is going on. Peppermint oil, eucalyptus oil. If there's congestion, that can really help open things up. But getting some tea tree up there, up into the nostrils, can really help with keeping down on anything that's maybe viral or bacterial, because you don't want to have something jump on board when your defenses are down with your allergies. So some tips there for sinus hygiene. Structurally, believe it or not, chiropractic may help. The reason for that is if you look at this spine, I apologize, that image is very blurry, but all the way up at the top, just a couple levels down from your skull, we have C2, which is the second cervical vertebra. The nerve that comes out at that level controls your eyes, your optic nerve, your auditory nerve, also has a lot to do with your sinuses, the mastoids, which are air cells as well, and bones in the face. So there's a lot going on there. I know when I started adjusting my mom many years ago, one of her first kind of aha moments was every time I adjusted C2, her sinuses would drain almost instantaneously. And she's had allergies her entire adult life, so that was always a great relief for her. So chiropractic can help, acupuncture can help with any kind of headache, as well as sinus headaches, helping the sinuses to drain. Craniosacral work is a specialized form of structural work, can be performed by a chiropractor or a massage therapist, somebody who has been trained in the technique, as well as sacro-occipital technique. Those are both very gentle and relaxing techniques that can help. And deep tissue laser therapy is another option that a lot of people have never heard of. This is using a therapeutic laser, so it's a therapeutic hot laser, not a cutting laser, not a cold laser. But this laser can use certain wavelengths of light to encourage your own cells to make more energy. And when they have more energy, they're going to repair themselves, but also do their jobs better. So it can reduce pain, reduce inflammation. I can remember back when we were demoing the laser we ultimately bought, I actually had bronchitis. And part of what really sold me on this laser was the rep did a sinus protocol, and it felt so amazing. And my sinuses drained like crazy for the next 24 hours. It was kind of gross, but then everything was gone. It was done. I felt so much better. The pain was gone. The congestion was gone. It was fantastic. So the laser that we use is Light Force. It's a Light Force laser. You can see a picture of it in the upper right. That is the one that almost all professional athletic teams use to take care of their multi-million-dollar players. So we use it in our office to take care of our patients. And again, it does a great job with sinus and allergy related headaches. I'm also a big proponent of essential oils and using oils from natural plants to help our bodies in a variety of ways. And if we think about it, most medications initially came from plants. So why would the oils be any different in their therapeutic value? So some of the top ones I recommend for sinus type headaches, in addition to the tea tree oil that we already discussed, first is peppermint, but really any of the mints, peppermint, wintergreen, spearmint, the minty things are going to help open up your sinuses and help with any congestion you might have. Eucalyptus, same thing. Lavender oil. Lavender has some antimicrobial properties like tea tree oil does, plus it's soothing and relaxing and it can help minimize pain. Also, lavender is great because unless you have an allergy to lavender, you can actually put the lavender oil directly on your skin for most people without any skin sensitivity or reaction. So you could, being cautious and careful to avoid the eyes, of course, you could put that on your sinuses for some local relief, as well as the peppermint. But again, you have to be super careful with your sinuses. And then the last one is oregano. And oregano is great, especially if there's a bacterial infection that's brewing in your sinuses. Now, with all of these, the brand that I recommend and endorse is doTERRA. I do not recommend other brands. There are some other great brands out there, but that's the brand that I know and trust. But I will caution you, and I think this is going to be on a later slide about big box stores, so we'll wait and talk about it then. So here is a picture of our online portal through doTERRA. So again, doTERRA is the brand that we use because they are certified pure therapeutic grade oils, meaning that they are distilled and clear and clean, and they don't have any harmful residuals in there from processing. Most of their products are what I kind of colloquially call nutrition grade. That's not a true term, but the point being is that you can ingest most of them safely, other than the ones that you would never ingest anyway. So that's great. If you were to go get an essential oil at a big box store, you can't trust that it's going to be safe enough to do that with. So that's doTERRA. Now, a few supplements that I recommend when it comes to sinus and allergy issues. The first is quercetin or quercetin, tomato, you can pronounce it either way. This does so many things for our immune systems and for our bodies dealing with allergies. And again, remember, allergies are just your immune system hyperactive. So this is a great supplement choice for some people. Astragalus, another great one that is kind of a modulator, so it can help to regulate an immune system up or down depending on what's needed. And then thyme. Thyme can actually help thin the mucus, so we could do a thyme essential oil. We could do thyme, the actual herb. We could put thyme in the pot on the stove that we're letting simmer to humidify the house. We can make a cough syrup with thyme that, okay, maybe you're not coughing, but you could still have a natural syrup that includes thyme to help thin the mucus and help get things out of the sinuses. So thyme is a great option. Vitamin D, super important for immune health. And again, at the end of the day, allergies are simply your immune system going haywire. So needing to calm it down a little bit, vitamin D can be great for that. So that's that. I happen to use an online portal called FullScript for my patients. It's free for me, it's free for them, which is awesome because they get paid by all the nutraceutical companies who partner with them. And this allows me to pick and choose the brands that I know and trust that are physician grade. And that way my patient doesn't have to go to 100 places and I don't have to have inventory. But they can get the best quality supplements delivered right to their house. Now, I mentioned I had a caution about the big box stores and third-party retailers, and this is for anything you would put in or on your body, including essential oils and including supplements. I do not recommend them. Third-party retailer would be something like Amazon. I don't recommend them because you just don't know what you're getting. At the end of the day, you just don't know. And there have been too many confirmed cases of essentially counterfeiting where people have put an inferior product in a superior product's packaging and sold it as the real deal when it wasn't. And I've seen stories like that and reports like that for supplements, for essential oils, for high-end body care products. So I always tell patients, if you're going to put it in or on your skin, do not. Do not. Or in or on your body, I should say. And then the big box stores, those are going to be places like Target and Walmart and Sam's Club. And yes, you can save money, but I would rather people buy fewer and make sure that they are spending their money wisely on things that are actually going to help them. And unfortunately, when you're going to one of the big box stores that is not carrying physician grade supplements or oils, at the end of the day, again, you just don't know what you're getting. There have been too many times where third-party independent companies have gone in, pulled things off the shelf, tested them, and then found they didn't contain what they were supposed to contain, or they had added in harmful things like heavy metals. So every couple of years, a story like that comes out. So I never, ever, ever recommend that. Find somebody that you know and that you trust and partner with them to get the supplements or oils, etc., that you need. Okay, I'll get off my soapbox. Now I have some obligatory disclaimers. None of the information or options in the presentation are intended to replace medical advice. And I hope I've made that super clear that you are encouraged to please, 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 if you are suffering from allergy and sinus headaches or headaches of any variety, to work with a qualified healthcare professional who can help properly diagnose it, properly treat it, help educate you on ways to take care of your body so hopefully it doesn't keep happening down the road. And then, of course, every supplement that I mentioned, every treatment that I mentioned, every oil that I mentioned isn't necessarily going to be right for every person. That's where you have to work with somebody who knows what they're doing. And, of course, it's not recommended you do everything. This was just a kind of a sampling of some things that can help. Now, as I promised, here is the slide with my email address on it, my office number, my office website. We have tons of information on our website. So I implore you to please stop suffering. If you are having these sinus type headaches, you do not have to continue. I hope that you found the information that we've been talking about useful. I hope you decide to take advantage of our special offer. This is Dr. Kelly Mulhern from Thrive Wellness Center, where we believe your body is designed to thrive.